We want to recognize some people. If you have traveled from outside of the country, would you just stand up and let us give you some applause? Jacques, I know that's you. Outside of the country, anybody else? Thank you so much. David, thank you. Welcome. If you've traveled from outside of state, would you just raise your hand for me? So many came from outside of state. We want to honor those that have come to speak for us. And if you don't mind, the speakers, would you just stand for us and let us just give you an applause and thank you for coming. Thank you so much, all the speakers. Thank you. And also, if you're an exhibitor, I want you to raise your hand. I want to honor you as well. Thank you for being here. We have Steve James. We have 90 exhibitors in the exhibit hall this year. And then one group of people that I always like to recognize, if you're under 25 years of age, now don't lie anybody, but if you're under 20, Becky, don't stand up, but if you're under 25, could you just stand up? And we want to just celebrate youth that are here with us today. Awesome. Good. Well, we have a great lineup of speakers and great lineup of exhibitors out in the exhibit hall, and we're very grateful for each and every one of you. We're also, as always, very grateful for our church sponsors. M3 is not an effort of just Lakewood Church. It's a multi-denominational effort, and I think we're better when we're together. Amen? And they're listed all in the conference brochure, but there's 3 churches that have stayed with us now for 5 years. Woodlands Church, Houston's First Baptist, and First Presbyterian. We appreciate all the churches, but we certainly appreciate you guys. Also thankful for Samaritan's Purse, who took the time, energy, effort to bring the Ebola Treatment Center to Lakewood this weekend. And this is just like the facility that was used in Liberia in 2014, just like the facility that's now currently in use in the Congo. And I hope every one of you will take the time to take that tour and see ways that you can be involved in the SP DART program. So Becky and all the group, we so are thankful for all you've done. I thought I would start the conference a little differently today. I thought I would just give you some tips on how to best enjoy the conference. And really, these tips really revolve around the vision that we have for M3. And the first vision we have is to create a space for people who have a heart for global missions to connect with each other. So I want to encourage you to be intentional about connecting with other people. It may be the person that's sitting beside you as you await a session to start. It may be as you walk through the exhibit hall, you catch somebody's name. Listen, be intentional about connecting with that person. Or perhaps as you have lunch tomorrow, rather than to just sit with your group and eat with your group, you know what? Just make an effort to connect with other people and have lunch with them, because you'll never know how God might not use that connection as a divine connection or a strategic connection that God has for your journey in global missions. And then the second thing, I would encourage you to be inspired as you hear from the speakers who are deeply engaged in global mission efforts. Now, I know most of our speakers, 99% of our speakers I know personally. And these are some of the finest people, the most amazing men and women who are deeply engaged in global mission efforts. They are a wealth of wisdom. They're a wealth of insight. They do incredible things right here in Houston, in our nation, and around the world. And here's the thing about it. They're approachable, they're available, and they'd love to meet you and answer your questions. So don't miss the opportunity to meet some of our speakers. I was talking to Dr. Gil Jackson. I think he's here tonight. But he told me earlier this week, 3 or 4 years ago, he met Dr. Russ White, one of our speakers. And from that connection, from that one introduction and connection, Dr. Gil Jackson went on his first missions trip to Tenwek Mission Hospital. So be intentional about meeting our speakers. And then the last thing is just do everything you can to find your mission. Now, what we mean by that, 90 exhibitors are circling the lobby up on the second floor, and all of those 90 are ministry organizations that really they're doing incredible work around the world. They're doing amazing work, and many of them need volunteers. So be intentional about spending some time at each one of the exhibitor booths. Now, that'll take a while, but we've given you plenty of time to do that. But be intentional about getting to know each one of the ministries and appreciate what God's doing through that ministry. Get to know what they do. Pick up a brochure or a card, or perhaps exchange contacts. Because again, as I said earlier, you'll never know what that one moment might be. It might be a divine connection that God has in your journey in global missions. I have 2 examples of that. I'm going to start with Kristen Long. Actually, let's start with Joy. Joy Vonk, why don't you come up and tell us your story?
Hi, you guys. I'm so excited to be here tonight. So a year ago, I was sitting where you are right now, and it was opening night, and Dr. Paul and Jennifer asked us two things. They said, "What's in your hands?" And they asked us to visit the exhibitors. So I thought about what's in my hand, and I thought, I'm a broken, empty vessel, what we just sang. What's in my hand is a yes, but I don't know what the question is. I don't know what the ask is from God, but yes, God. And so walking around and visiting the exhibitors, one of the booths that I went by was Samaritan's Purse and World Medical Mission. And Dr. Paul and Jennifer had been very faithful in their encouragement and supporting that ministry. And so I left with materials in my hand, but no action plan. And God opened the door for a season where I could actually go onto the mission field for a longer period of time and give more than just a week at a time, but really give him more time. And I felt like that's what he was asking for. So I am freshly back from Kenya and from working with a Samaritan's Purse hospital there. So I would just encourage you today, listen to what God is telling you and just be available. He will shine his light into your life as he does in all of these nations that we're hearing about today.
Thank you, Joy. Kristen, go ahead.
Okay, thank you very much, Dr. Paul, for having me up here to talk to you guys. I have a story very similar to Joy in that 5 years ago, I was sitting here just like you guys in the inaugural M3 conference, and I had spent some time in my general surgery training in Kenya and knew I wanted to have that as a part of my life and a part of my academic career, but I had no idea where to go forward. And I think that I love being back here at M3 2020, and I think it's interesting because if you think about it, hindsight is really 2020, and my path now seems very clear when I look back at the steps that led to where I am today. But at the time, I couldn't see it. The theme of this conference is, can you see it? And I sat in the audience and was thinking, I want a way to serve. I want a way to help people outside of the United States. I want to try to give my skills, but also learn and grow as a person and as a surgeon. And I sat there and listened to Steve James speak about his labor of love. And lo and behold, after I started my faculty job a year later, got an email that said, "We need a surgeon. Can you go?" And I said, "Yes, I can go." And didn't even think about what it was, looked back, found the organization, and it was Kenya Relief. And it kind of came full circle for me at that moment. And since then, in the past 4 years, I've been with them 6 times. And this is my second time back here at M3 speaking. And so I couldn't see it then, but I can see it now. And I think the most important thing you guys can do is go and talk to these exhibitors. There's over 80 booths out there. Anyone who works for one of these organizations can tell you that the people who represent these organizations are talking to you about their labor of love. They put their entire heart and their soul into this. You will learn from their stories. You'll be inspired. And if you can't see it now, you will see it in the future, and you'll be back here at this conference telling these stories. So thank you for having us.
Thank you so much. Tonight we're going to hear from some of our friends that we've known for, most of them that we've known for a long time. Dr. Alyssa Feaster spent a lot of time with her for 2 years in Kenya when she was there at Tenwick Mission Hospital. She's an amazing person. She's a great doctor. She has a great heart. Now, Alyssa and her large team of colleagues are literally changing the landscape of the medical care and the educational care in the nation of Burundi. And I'm so thankful that Alyssa has traveled all the way over here to be with us. Dr. Jacques Eberle is from the Democratic Republic of the Congo. He did his training with the PAX program, both in Cameroon and then finished it in Gabon. He now works in Dayun Luke Hospital in Malawi. And I can tell you that Jacques, I knew him when he was in Cameroon. He is an incredible person. He's a gifted surgeon, and he's an amazing leader, and he's making a big difference there in Malawi, and so glad that he's here. Dr. Jenny Dyer is also here, been a friend of ours for several years. Jenny is a passionate advocate for maternal and child health and for bringing an end to hunger. I've been with her on Capitol Hill, and she's a brilliant person with great influence, but she's using her influence to help poor people around the world. And she brought with her Jeremy Everett, and Jeremy I just met, but he's the executive director of the Baylor Collaborative on Hunger and Poverty, and we're so glad, Jeremy, that you're here to help us tonight. And then one of my favorite people is here. I've known for many years, 13 years now, Dr. Mike Chupp and his wife and family served at Tenwick Mission Hospital for many years. and over 5 or 6 years there, we overlapped with him for many months and probably many years, really, over 1 or 2 years. And I can attest that he and his family are just quality people. Mike is a skilled surgeon. He's a gifted leader and a gifted administrator, and he's a good friend, but he's now the Chief Executive Officer of the Christian Medical and Dental Association. And Mike, we're so glad you're here, and so glad you're going to share all of our speakers. But as we begin 2020 M3 Conference, let me remind you of some words that Jesus said in the book of John. In this passage, Jesus was in Samaria, and Jesus could see clearly the great opportunity there was around him to help the people in need. But the disciples could not see what Jesus saw. The opportunity was clearly in focus for Jesus, but was obscure and fuzzy and blurry and out of focus for his disciples. They simply couldn't see what Jesus saw. So Jesus then just encouraged them, open your eyes and take a look at what's right in front of you. The fields are ripe. It's harvest time. In other words, Jesus said, take a look at the opportunity that's right in front of you. Bring it into clear focus and do what you can to help. In the same way, here are some of the issues and the opportunities that we face as the world in 2020. Every day, 830 mothers die in low-income countries all around the world. 70 million are displaced or refugees. 800 million lack access to safe water. 40 million are trapped in modern-day slavery. 420 million children live in war zones. 800 million suffer from chronic hunger. 5 billion have no access to safe, affordable, timely surgery. And 2 billion have virtually no access to the gospel. These are issues that are right in front of us. They're either clearly in focus or they're blurry and out of focus. And these sheer numbers can be overwhelming to us. And it's so easy to think, there's nothing that I could do to make a difference in problems of this magnitude. But this weekend, I want to encourage you to challenge that assumption, because perhaps there is something that you can do. This weekend, you'll hear from men and women and visit organizations in the exhibit hall that see these issues clearly. And they are deeply engaged and doing what they can to help in these problems. And our prayer at 2020 M3 is that each and every one of us would see the world through Jesus' eyes, that we would bring these issues into a sharp focus, 2020 vision, so to speak, and that we could pray too how we could get engaged and do our part in helping and making a difference in a broken and complicated world. But here's my question as we start M3. Can you see it?
I felt hungry most of my life. We struggled for everything, including clean water. And I would watch mothers with babies sobbing and begging for any little leftover corn so they could at least just feed the babies. These were moments that I wondered if God had forgotten that there were still people living in Tonje.
An Ebola treatment unit is definitely a massive undertaking. Hygiene, sanitation, there's the clinical aspect. It's a massive undertaking and each part is critical.
It's much worse than I ever thought, that you just can't identify with unless you're here.
If you come to a group of 10 people holding up a heavy log, and 9 of them are on one end of the log, and 1 of them is on the other end, and you want to help, where are you going to go?
When it comes to God's plan to change the world, we are His plan A, and He doesn't have a plan B. We're it.
If you're following Jesus and it doesn't lead you to hurting people, you're not following Jesus.
Why wouldn't we go to those that need it the most? I'll go wherever you want me to go because this good news, it's not just a good idea. It's full of power that brings transformation to people's lives.
Will you believe what God says about you? We believe it's not too late. It's not a mistake. Your dream is real. There's a place for you. There's a need for you. Even if nobody goes with you.
Jesus said, I'm telling you to open your eyes and take a good look at what's right in front of you. Can you see it?